Okay, so if Eric, please, or Kathy can monitor the waiting room, I will go ahead and introduce Dr. Compton. As you probably have seen, Dr. Compton is a family medicine specialist, and he earned his Bachelor of Science in Neuroscience from BYU. And he went on to earn his DO from Lake Erie College of Osteopathic Medicine. He completed dual residency training in family and preventative medicine and obtained his master's in public health from Loma Linda. Dr. Compton loves to partner with and empower his patients to achieve health goals by encouraging healthful patient-driven actions. And if you would all just write your questions down in the chat, and if you're not sure how to do that, we will be doing questions at the end of the presentation. So we'll let Dr. Compton finish, and then there will definitely be time to answer all of your questions as time allows. We won't go over the hour. Okay, and I'm going to turn this over to you, Dr. Compton. Thank you.
Thank you, Melissa. I really appreciate it. So yeah, I'm Dr. Compton. Hello, everybody. I'm kind of scanning through the participants and taking a quick look at everybody. Hi there. Yeah, so, I'm a little bit newer to the area, and I'm really grateful for this opportunity to talk. I just recently finished my residency out at Loma Linda, and as was said, I trained in both family and preventive medicine. So I have a little bit of a different take than your typical family doctor on some topics. But today, our topic is lifestyle medicine, how to develop healthy habits. And the question that I kind of have in the back of my mind is, how can that I imagine some of you have is, how can lifestyle medicine help me age well, and what are the good habits to keep in my life. And at any point, if you have if I'm using medical jargon or something that doesn't make sense, feel free to interrupt me. That's okay. Or you can type it in the chat box, and I'll try to clarify what it is that I mean by that word. Speaking of medical jargon, here's another one. This one is what is lifestyle medicine? And I have let me explain what that is. So lifestyle medicine, it's focused on the key behaviors that we have in our lives that either bring health towards us or it pushes health away. It identifies the ingredients for our bodies to heal themselves. It's the right balance of sleep and exercise, stress, purpose, relationships, and nutrition. And I feel like these are kind of the basic things that everybody should know to have health in their life. I feel like it's what should be taught in the grade schools, if to be honest. And let me introduce what's called a lifestyle medicine pyramid. You'll see that just like the old traditional food pyramid, the base, the things that we should include the most in our life for health, the things that really give us the most impact and should be the foundation of a healthy lifestyle or of health, is what we do at home. The vast majority of our health is dictated not in the hour that we spend at the doctor's office, but in the other 23 hours, how we spend our time and what we do. It's estimated that about 80% of our health comes from our day-to-day activities, whereas somewhere between 10 to 20% is really changed by what we do in the doctor's office. So you'll see at the bottom here is lifestyle. It's the cause and the cure of really most communicable diseases, non-communicable diseases. That's nutrition, exercise, sleep, stress, relationships, and purpose, etc. Above that, you have what we've been taught by studying physiology. So with physiology, you might understand the role of calcium metabolism and vitamin D and how those work in our bodies. That might prompt you to start taking some, vitamins and minerals, and that can have an impact on our health. Um, Above that, you'll see prescriptions, and as you'll notice as we go up, you'll see prescription and surgery. And as we move up this pyramid, risk also increases. It's hard to, overdose, so to speak, on some of the lifestyle things, but it's much easier to, um, you know, have an overdose, say, of a prescription medication. And so risk does increase as we go up. Um, Specific drug prescriptions, surgery, they all have their place. They're all good. They are good things when it's indicated, when they have their place. There's that. And this is, I just want to mention here, this is by Mark Brahman. I believe I actually met him at a conference before, and he's the one who made this pyramid here. Let me tell you a story about a patient of mine that I had about 3 years ago in 2017. And just to change his names, I'll call him George. He was about 58 years old, male patient. He had pre-diabetes, he had hypertension, he had heart disease, fatty liver. He had just recently been discharged from the hospital due to a heart attack scare. Had some chest pain. Turned out it wasn't a heart attack, but there were a lot of other things going on that were wrong with him. And he didn't like going to the doctors. So there was nothing wrong with him as long as he didn't go to the doctors. Nobody told him there was something wrong. So, but after the scare, he ended up coming in to see me. And, we talked not only about his medications, but also, what was going on in his life. He had several visits with me to monitor lab work, talk about the increased medication that he was put on while he was in the hospital. And I got to learn a little bit about him. I learned that his daughter was a nurse, and I learned that his health in the past used to be pretty good. And I found out that he used to love to hike. Talked with him about who his supportive people were in his life, and who also had the skills to really be helpful to him as he was trying to change his health. I found out that his daughter, who was the nurse, really knew healthy recipes, and we set out on finding a goal that he would find enjoyable to improve his health. And that goal was to restart hiking and to talk with his daughter about eating more healthfully so he could be around for his grandchildren. That was really what was his core motivation. Amazingly, he came back 3 months later, about 20 pounds lighter, and he was walking about a mile a day. And I was just astounded by the water weight that he lost. Another 3 months went by, and he came back, and he was 30 pounds lighter. And he was walking 3 to 5 miles a day. And then a whole year later, after his diabetes and his heart attack scare, he was no longer at risk for diabetes. He had reversed that, and he was able to decrease his heart failure medication. His legs had been huge, very swollen, because his heart wasn't pumping the fluid out of his legs. But with the combination of medication and the exercise that he was doing, something that he really loved, getting out in nature and hiking, his legs had shrunken back down to a normal size. And this is just one example of finding a key habit or a key behavior that has a cascading effect on all of his health. And he made kind of something of a minor change. He started talking to his daughter about recipes for food, for what he should eat, and he started hiking. Two relatively small changes, but it had a dramatic impact on his health. And the question is, was he destined to have heart disease and prediabetes because of his genes, or is there, or did he exert some sort of control on his genes? And so I want to share this with you and ask this question. Um, you know, can we control our genes? My patient, well, he obviously had the genes that allowed him to get very sick. But interestingly enough, he also had the genes that allowed him to be healthy. There are some people that get very lucky who are resistant to developing diabetes or heart failure, despite an unhealthy lifestyle and excess weight. But for the majority of us, can we control the expression of our genes? And that's something I wanted to dive into today. And the answer to that question, can we control our genes? Yes, we can. Focusing on the base of the pyramid is helpful because it's what you can do to control your genes. There are some medications like steroids that can stimulate and inhibit some gene expression. There are experimental treatments out there like that can alter the genetic code like CRISPR that are in clinical trials, and I'm really excited for that. But those are somewhat more high-risk applications of gene control. So let's talk about the process of genes, and I'm going to take you into a little bit of my undergraduate and some of my medical school education here. Okay, I hope this isn't old information for everybody, but this is the basic process of gene expression. You know, the double helix of our DNA. It's twisted. It's like a ladder that's been twisted around. And there's about 3 billion base pairs or ladder rungs, about 3 billion rungs on this ladder. This double helix gets untwisted, it gets unzipped apart, and that genetic information is transcribed. It's just a copy is made, just like transcription. That transcribed or that copied piece of genetic information dives down and outside of our nucleus of our cells, and it gets translated. And when I say translated, that little piece of genetic code goes through a big protein called a ribosome, and it starts making proteins. And those proteins are what make our muscles. It's what makes our enzymes. It's what does just about everything in our body. Those proteins get built up and they get packaged into cells that do different functions in our body. And so if our DNA has to be unzipped to basically be read, what determines what part of our DNA gets read? Out of those 3 billion base pairs, it's not getting all read at once. Some parts are read when we're little, some parts kind of get shut down as we get older. And how can we modify that? What's the system in place? And what you'll see here is that there's a couple different methods for controlling that our bodies use to control genes. One of them is called histones. So you'll see those big discs on there, and you'll see that DNA strand that's wound around. I believe it's 2.5 times. I forget the specific number now, but it's wound around that. And while it's wound around that disc shape called a histone group, it cannot be read. And so the DNA kind of has to shimmy and move over and become available on the spaces in between. But you're not going to get that read if you have one of those little blue dots there. Those little blue dots are called is a methyl group. And so our DNA, what happens here is in the upper picture, see those little blue dots? Well, they get taken away, they get unmethylated. And then you'll see in the lower picture, you don't have the blue dots, and then that DNA can start getting read. So it's a process of removing the methyl group so it can get read. And so the question I will ask is, well, how do we how do we move those methyl groups out of the way? And this is just one way that our DNA is controlled. There's other ways too, but this is the main one that I'll be focusing on today is how do we remove those methyl groups? So actions that change our gene expression. We have some of the basic and fundamental tenets of lifestyle medicine. I want to show you can change our genes, or change which genes are expressed or being read and transcribed and translated into proteins. So we have exercise, sleep, psychological stress, and nutrition. I'll just focus on those today and go through a couple of these studies. Here's one study. Let me make my reading window here just a little bit bigger. This is called Exercise Training and DNA Methylation in Humans. And one of the highlights of this is that I wanted to show is both acute and chronic exercises significantly impacts DNA methylation. So what genes are being expressed can be changed by a recent exercise as well as long-term exercise. Now, the national recommendation is 150 minutes of aerobic exercise every week, and I think that's really important. That's about 30 minutes every day of aerobic exercise. And then the other part of that a lot of people forget is the anaerobic, kind of the weight training, the resistance training. That should be done at least 2 times a week, and I feel like that's an important part of the picture that is missed for people of all ages, but I would say especially important in those 65 and older to do some form of resistance training. Here's another study here on in the journal Epigenetics. And while this was not a slam dunk piece of it wasn't a slam dunk article. It did suggest that exercise can increase the methylation on one specific part of our DNA. And that part of our DNA was called a line segment or a line element. And what you see with line elements is that if you don't have enough methylation on it to kind of calm it down, to shut down that part of our genetic code, then we become very much susceptible to inflammation. And there's an association to the less this part of our genetic code is methylated, the more inflammation we have. And that was explained more clearly in this next study. You'll see the title is Methylation of Endogenous Human Retroelements in Health and Disease. And they're talking about those elements inside of our genetic code. And one important part of this is that they saw that the lack of exercise led to low methylation and therefore chromosome instability. Now, this can be a little bit confusing. I'm talking about DNA here, right? So DNA is that double helix ladder that has all of our base pairs and our genetic information on it. When it gets wound up around those histone groups, that's called chromatin, just a larger structure. And then if you kind of zoom out and you look at our genetic code from a distance, you'll see that we have the X and the Y chromosomes, different sections, portions of our genetic code. And so what they found in this is that chromosomes actually become more unstable when you don't have that methylation activity. So my summation of this is that exercise helps make our chromosomes more stable, and that's really important for diseases like cancer, where it's the aberration of our chromosomes, of our genetic code that's causing basically an uncontrolled cell growth. So Here's one on sleep, our next kind of lifestyle medicine topic. We already know that from looking at people who work night shifts, who don't get enough sleep, that they really do less well regarding their health. And what we'll see is that the sleep is actually affecting the which genetic codes is getting read. This study is suggesting that it is the histone remodeling, which parts of our DNA are wrapped around the histones that can regulate our circadian rhythms. Um, and I'm sure many of you have heard of what a circadian rhythm is. It's just our our sleep and our wake cycle. Um, and yeah, the how our sleep is affects which part of our genetic code is being read. And here's a link between our circadian clocks and breast cancer. And we already know that there is a link between diseases like breast cancer and sleep. And scientists are working on understanding the particular molecular pathways that are involved with that. Let me move on to nutrition and talk about cancer prevention through the molecules that we find in our food. And one of those molecules are called dietary polyphenols. Polyphenols, they come in higher amounts as you can see in this article here. You'll see them in green tea, you'll see them in turmeric, you'll find them in soybeans, and broccoli, and actually the whole broccoli family, which are cruciferous vegetables, are pretty high in polyphenols. And what this does is is that those chemicals can make changes in, again, our DNA sequence, which parts are getting read. I think I just have one or two more studies to introduce you to. And one of these is on psychological stress. And in this particular study, there were children who were they looked at people who committed suicide, and they looked at their genetic code and which parts were methylated. And what they saw is that that those who had unfortunately experienced child abuse, they had different regions of their genetic code that had been altered by that psychological stress. That it was methylated, and some parts of their genetic code were getting suppressed or toned down because it was methylated. And they looked at age-matched controls who died of something else, and they saw a completely different pattern in those who had not experienced child abuse. And so we talk about the combination of nature and nurture. Which is it? Is it our genes that really determine our outcome, or is it our environment? Well, what we're seeing here is that our environment can affect the expression of our genes. And so it's not a question of nature versus nurture. It's really both. And then just to give another highlight on this, psychological stress. This study, unfortunately, was not in humans, but it talks about maternal behavior in dogs, where they report that the pup being cared for by its mom actually changed the methyl groups on it and and was able to change it. It's just really amazing that how our nurture changes our genes. And what they saw is that um, I'll read this last line here. They show within an epigenetic state of a gene, it can be established through behavioral programming, and it is potentially reversible. So they were able to alter the which genes were being read and expressed by how the mother was caring for the pups. It's really interesting. Let me pause here for a moment and take a look. I see that we have a couple of chats. Um, and I might save some of these for the end. Okay, yeah, I see questions about sleep and also some kind of a supplement. And hopefully I'll be able to touch on that after. But let me show you here. Oops, I clicked out of it. This is a summary from a really great article about all the things in our environment that can change our genetic code. You'll see that there's food that affects DNA methylation, physical activity, tobacco smoke, even the time that we spend inside our mother's womb can affect our gene expression. Alcohol and pollutants, um, you know, shift work, those all affect the methylation. Whereas there are some other food items and physical activity that can change the histones, or the parts of our DNA that are wound around those discs that I was showing you. And then there's another method for changing our DNA, which is the microRNA expression. And there's evidence suggesting that physical activity, cigarettes, and again, in our uh, intrauterine life can, and the environment around us can change those microRNAs. And so to me, this summary slide of this article that I read looks a whole lot um, like this one to me. That our lifestyle, those things that we choose, those behaviors, they can be they can either bring health towards us or it can push health away. And I apologize. Let me pause here for a moment and get back to my other slide. There we go. Okay. So I wanted to spend just a few minutes talking about strategies for how to make meaningful change for nutrition, exercise, sleep, stress, your relationships, and finding purpose. And here are a few of the strategies. These are not necessarily evidence-based. I don't have any um, I don't have any articles out there saying that this is the best way to change your behavior, but to me, these are the ones that I've found most beneficial. So if you're thinking about a lifestyle topic, whether it be sleep or exercise or just connecting with others, these are some strategies you can use to make that to help you make a change. Um, One is making the best choice the default choice. If there's nothing else inside your refrigerator except for bottled water, well, you know you're going to be drinking bottled water, right? Or if you have a bunch of ice cream in the freezer, well, it's at hand, so you're going to end up eating the ice cream, right? That comes down to changing your environment. If you're having a hard time getting up and getting your exercise done, well, maybe setting your exercise shoes and your exercise outfit right next to your door so you're always seeing it and you're interacting with it more. That's kind of the principle of propinquity. Another thing that I find very helpful is to have people partner with a friend, a coach or a doctor that will set goals with them. And people who are like-minded who will help you along your path for making behavioral changes. One critical part of this is identifying the reasons why you're doing it. It's identifying your purpose. You know, why am I doing these, these 10 push-ups? Why am I getting out and walking every morning? Well, for my patient, it was for his grandchildren. He wanted to be around for his grandchildren. Um, One thing that I find that gets in the way of people making significant change are emotions. Um, if you find that you're becoming anxious or depressed, and that those are barriers to the behaviors that you want, then it's time to work on that. Quantifying the change that you want to make can also be helpful. Making your goal visible. So up on your refrigerator, say you want to get more of those polyphenols from your cruciferous vegetables, and you want to drink those 3 to 5 glasses of water a day, then what you can do is make that change visible by putting a little checkbox on the front of your refrigerator, and that can also be beneficial. I would recommend making one small change at a time rather than jumping in and um, trying to change your exercise, your sleep, and your nutrition all at once. Though I do see a cascading effect. Once you make one important change in your life, I find that it can also often cascade into other positive changes. I'd recommend setting small goals. And I say small goals because what is the thing that helps bring motivation to someone? Well, it's past successes. If you've had a past success, that greatly enhances your motivation for future activities. And as you might have already identified a habit to consider, here's a list of habits that I would consider high yield that are important ones. And if you're missing one of these in your life, then I would try to add it. And these are the habits. Exercise your brain every day, whether that's crossword or working on a complex problem. That's something very important for individuals of every age, but even more so over the age of 65. There's also a study out there that trying new things can stimulate new neurons to be made in your brain. Whether that's trying a new food or trying a new experience or a new activity, that can stimulate neurogenesis. Maybe that's just trying a new spice. Um, Staying active. There's a saying that motion creates emotion. Moving your body can help bring out, positive emotions in your life. And I think we've all felt this way if we're all just kind of sitting down and not moving all day long, sitting on Zoom meetings all day long. That can really, decrease your positive sense of well-being. And so movement is a critical piece. Eating your fruits and vegetables, those have a prebiotic effect for gut health. Eating intact grains, beans, and legumes. It's really eating the real food, stuff that our great grandmothers would recognize as food, instead of these science experiments that we find in the packages. Cultivating purpose in your life, resting well, drinking water. I would say at least one tall glass of water every morning and for each meal, as long as your doctor said you don't have to restrict your fluids. And then getting sunlight every day. I'd say 15 minutes of early morning sunlight can help set that circadian rhythm and get you on a good sleep and wake cycle. All right, so in closing, I just want to say, people can change. It's really possible. And it's not only the psychological change, and it's not just the behavior change. You can change the expression of your genes. The key behaviors for health and lifestyle medicine include sleep, exercise, relationships, and avoiding some of those avoiding harmful substances. And I just want to invite you to choose one thing to change and partner with somebody who's going to be willing to talk to you and help you out on your journey. If you want to learn more, I would recommend a couple different websites. One is lifestylemedicine.org. That's an organization that I'm a part of. There's a great informational website called nutritionfacts.org that has short video clips. And I would say that I agree with the vast majority of the content that's on there. And I saw one of the questions that came through on the chat about spirulina. There's a short video on nutritionfacts.org all about spirulina that I'd recommend checking out. And then there's my website, which is mychealth.com. It's in the works. It's going to be up soon, but I'm going to have great links about where to go for healthful information on that website. So in the future, if you want to check that out, I should hopefully have it up soon. If you are looking for a little plug for myself, I'm at a new location up in La Cañada. You can find me on Google. These are my office hours down here, and there's my telephone number down there at the bottom, the 818-643-7128. If you know somebody that wants to schedule an appointment or needs a family doctor who's going to partner with them for behavior change. With that, just want to give a thank you to everyone for your time and your attention.
Thank you, Dr. Compton. That was really interesting, and I have a feeling we're going to have quite a few questions. Let's look in the chat. And
Melissa, the first question I saw was from Lucy. She wants to know, what does DO mean?
Right.
Oh,
That's
perfect.
right.
Great. Yeah. So I received my medical degree from the Lake Erie College of Osteopathic Medicine. And so I'm considered a doctor of osteopathy. And that was, you might have seen in the news about how there was a DO taking care of President Trump during his COVID illness. That is, for most intents and purposes, it's a medical doctor. Okay, so I'm a medical doctor, but my degree is as a doctor of osteopathic medicine, and that means I do. There are DOs that do surgery, that are orthopedic surgeons, that are neurosurgeons, cardiologists, that are family doctors. And DOs have a philosophy of focusing on the mind, body, and the spirit all together, try to encompassing the whole person, and try to provide those ingredients and the right environment that will help a person heal themselves, actually. So yeah, thank you for that question. I appreciate that question.
Do you want me to read the questions, Doctor?
Oh, that'd be great. Yeah, thank you.
So the next one that I see says, "Hi, doctor. I would like to know how bad or good it is to take 1/2 spoon of spirulina and 1/2 of moringa powder. And also, please tell me about omega-3. Thanks so much."
Yeah, great. So I do appreciate that question. I don't think I'm very well prepared today to talk about spirulina and moringa powder, but again, on that website, nutritionfacts.org, there is a brief video, I think it's 3 to 5 minutes, that he talks all about spirulina. And whatever he says on that topic, I'm probably going to second it. Now, about omega-3s, there's a couple different fatty acid chains out there, omega-3s and omega-6s. Those are the ones we kind of focus on. Omega-3s are typically found in your fish oil supplements, and they are supposed to help with your cardiovascular health, your heart and your brain health. There has been some shade that has been cast on that most recently in the literature, and so the evidence to me is not 100% on the benefits of supplementing with omega-3s. It's questionable, but omega-3s are necessary and helpful. The more omega-3s you have compared to omega-6s can decrease your body's inflammation. And as we know with coronavirus, it causes massive amounts of inflammation. Many diseases out there cause a lot of inflammation in our bodies. And so I think that overall, the more omega-3s that you have compared to omega-6s will be helpful. There are other sources of omega-3s, and that include things like flax seeds. Ground up flax seeds have a wonderful amount of omega-3s in it, and you won't have the heavy metals that you can find in the fish oil supplements that sometimes get tainted. So yeah, I would recommend flaxseed to get a higher amount of those omega-3s.
Okay. Next question. I am wondering how taking terbutaline may affect the intrauterine baby during the last 3 months of a pregnancy.
And I wish I had more information on this one to share with you. That's a great question for the OBGYN
Okay.
that you may be working with.
Okay.
Terbutaline, what terbutaline does is it stops the contractions from happening, for those who don't know.
Oh,
And yeah, and it can help the baby kind of stay in the oven a little bit longer, so the baby can develop. Trying to keep the baby in that environment is probably the best place for it, so long as there's not an infection going on, and so long as it's not harmful to the mother's health. I think that the baby should stay in it as long as possible.
the next question is folic acid. How important is it for seniors? And please explain. Thanks.
Folic acid is very important. I read a paper as I was preparing for this talk about folic acid, and folic acid can change the methylation of our genes. If you don't have enough of it, that's a real problem. But I read I read another paper on it too, saying that we should not be over supplementing with folic acid when it comes. We shouldn't use it in super therapeutic levels. We should be cautious with it, because that can also turn on harmful genes in our genetic code. So I don't recall off the top of my head the daily recommended value for folic acid. I think it's 400 micrograms. Somebody can check me on that. But the preferred source of getting your folic acid would be your dark leafy greens, your spinach, your kale, your Swiss chard. That's where I'd try to gravitate towards to get your folic acid. I think if you're getting your recommended amount of fruits and vegetables during the day, then you probably don't need to supplement with it. Thinking back to the pregnancy question, folic acid is incredibly important for proper spinal cord development in babies. And so it's recommended that women get, I believe it's the 800 micrograms of folic acid per day.
Okay. Next question. Using this framework, what went wrong in the case of autoimmune disease?
Yeah.
That's probably a big one.
That's probably I'd probably have to study a little more on that one to answer.
Yeah.
That is a wonderful question.
Yeah.
That's a great question to make me start thinking and do some more research. But I would have to do more research to answer that question.
Okay. Well, you know what? Maybe we'll have round 2 another time.
Maybe. What I can say though is that autoimmune disease, it's where your body's immune system starts attacking your body, okay? And what that leads to is a whole cascade of inflammation in the body. I can't think off the top of my head of a single autoimmune disease that does not include lots of inflammation. And so what can you do to decrease inflammation? Well, in that one study I pointed to, the exercise, chronic exercise decreases line elements in your genetic code that will that can decrease inflammation. Fruits and vegetables, turmeric, those elements that have the polyphenols in it, those can all help decrease inflammation as well. So what can you do besides taking, steroids and things like that, those prescriptions? You can have low inflammation, an anti-inflammatory diet, and focus on behaviors that will decrease that inflammation in your body.
Okay.
By the way, Dr. Compton, I did Google about the folic acid, and you were right, 400 micrograms for adults, or between 400 and 800 micrograms of folic acid if women are planning on getting pregnant.
Perfect. Thank you so much. Appreciate doing that.
Okay. A few people want to see your contact information again. So at the end, why don't we put that up? And I have one more, well, no, I have a few more questions actually.
Okay.
If I sleep for a total of 8 hours with waking up about 4 to 5 times in between a night, should I seek a doctor's help?
That's a good question. That's probably one you'll want to, it's okay to wake up a couple times during the night, but if it's causing daytime sleepiness and it's affecting your ability to function during the day, that can be problematic. So if it is affecting you negatively, then I'd probably talk to a doctor about it. If it doesn't seem to be impacting your daily life, then, it's okay to wake up a few times. And most of us do wake up several times during the night, and we just don't remember it. We fall right back to sleep. So you might be one of those that are experiencing waking up and remember waking up.
Okay. Here's another one. As a general rule, under what circumstance would it be of benefit to go or be referred from a family practice physician to a gerontologist?
Right. Yeah. So a lot of family doctors end up specializing into geriatrics. And I think that if you're aging well and you need your regular preventive care and things are going relatively well for you, I would say family doctor is going to be your best bet. They're going to know, hopefully you'll have established a relationship with them. They know your story. I think that there's a great benefit in staying with somebody who knows you and you know them, having built that trusting relationship. A gerontologist, I've worked with quite a few in the past. I love their expertise with helping people in case they need to help, navigate the system to get into a nursing home. If they have specific questions about memory and specific concerns about, let's say Alzheimer's and things like that, partnering with a gerontologist who might have a neurologist that they work a little more closely with could be a very beneficial thing. So I'd say as a default, see your family doctor, but gerontologists are certainly very capable, and many gerontologists are, in fact, family doctors who are trained as family doctors initially.
Okay. Here's another one. I hear that one needs to be careful with buying omega-3. It might not be too fresh, might be rancid. How can you know how fresh it is?
Good question. I don't know the answer to that one. I would say, I would look at the label and make sure it's not expired. Beyond that, I'm not sure. My thought is that if you're getting it in the fish oil form, that they'd be more likely to go rancid in that form as compared to finding it in a seed, as I mentioned.
Okay. My husband with heart issues takes a multivitamin, vitamin D, and vitamin C. Should we add fish oil supplements?
My gut feeling on this one is probably no. But there are so many aspects to one's health that I think it's probably a good conversation to have with your doctor, whether or not you should be adding it. I don't recommend fish oil supplements across the board. I would rather my patients get it from a source that is much less risky in terms of mercury and heavy metal contaminants.
Okay. We have one more question, and this is, how can a family doctor know you well when they spend only 20 minutes at most?
Yeah. So some family doctors do spend a short amount of time with you. That's very true. For me, my new patient visits are 1 hour. And then afterwards, I'd expect to spend anywhere between 20 minutes to a half an hour with follow-up visits. And it takes time. It takes time to get to know somebody and really understand their health. There are patterns to health. There are general recommendations that I can make for everybody on this Zoom call. But understanding that person's specific health concerns definitely takes another level of understanding. And it is hard to do in 20 minutes. I certainly agree with that sentiment.
Okay. Well, thank you so much, Dr. Compton. And if you wouldn't mind just putting your contact information up for anyone that might have missed it, that will be, do you still have that available? I
Yeah,
haven't.
Are my
Okay,
slides
you
still up, or are they
No,
not showing
I
any?
stopped the screen sharing so that we could see you. So if you could restart the screen sharing.
Yeah, I'll restart the screen share here so everyone has a chance to take a look at it.
Okay.
Let's see. Find my Zoom controls. There they are. Okay, how's that?
Thank you. That's perfect.
All right. So yeah,
Okay.
down at the bottom, my number is the 818-643-7128. Yeah, accepting new patients. So
Wonderful. This has been so helpful and very kind of you to share your time with us today. I know it's very valuable. And thank you all for coming and for asking such great questions. I know we certainly learned a lot from those, and as well as the presentation. Oh, wait, we got one more. Doctor, do you have, there's lots of thank yous in the chat, but do you have time for one more quick question?
sure, yeah.
Okay, I have osteopenia. I was getting Prolia shots 2 times a year, but my 2 last DEXA bone scans had better numbers, and so I don't qualify for Prolia anymore. I really don't want to take Fosamax because it causes bone brittleness. Do you have any suggestions?
Yeah. So the Fosamax can be helpful, but there are side effects with all the medications. What I'd point back to is what we talked about today. Have we focused and have we optimized and maximized the bottom of that pyramid? Have we optimized the exercise to increase bone production? Have we optimized the diet in order to have the right amount of vitamin D and calcium that you're getting? Are we getting enough sleep? Yeah, I'd kind of circle around to doing those things and focusing on that. If you are uncomfortable with taking Fosamax, because you're absolutely right, each medication can come with significant side effects.
Okay, with that, I just wanted to just read a couple of the comments. Thank you so much. That was a wonderful meeting from Antonio and from Paula and Phil LaGrandier. Thank you so very much for this most informative webinar. So helpful. So
all right, you're welcome.
With that, I think I'm going to conclude our meeting, and thank you very much, Doctor.
Of course. Bye.
Goodbye. Bye, everybody.
Thank you. Bye.
Thank you.
Bye.
Bye, Paula and
Thank
Phil.
you, Dr. Compton.
Thank you so much.
Oh, Paula and Phil, yesterday I mentioned about the Zoom being more than 40 minutes on Thanksgiving. Didn't I talk about it?
Go ahead.
Oh, well, I thought it turns out that it's 9 o'clock on 9 p.m. on Wednesday.
What is this?
So it's all day Thanksgiving. So 9 p.m. on Wednesday, all day Thanksgiving until 3 o'clock in the morning on Friday.
Well, that's
So that'll
good.
be in next week's newsletter.
Yeah, that's wonderful. Thank
Yeah, I
you.
think it's pretty cool.
Did everybody hear that for you that are still on? That was something pretty great that all of you that have downloaded Zoom and now you're using it and you're getting more familiar. Kathy's just telling us that we've got, it's from 9 o'clock Wednesday night for 90 minutes.
No,
Kathy?
no. They've taken away the 40-minute limit. You used to have 40 minutes for
Right.
free. If you went over 40 minutes, you got charged. Now you could be there. Zoom is taking off that 40-minute limit. So you can be on from 9 o'clock p.m. Wednesday, all day Thanksgiving until 3 o'clock in the morning on Friday.
Nice.
Yeah,
That's good.
so that's good. That's good information since Thanksgiving is going to be looking a little different this year. So maybe
lot.
Christmas too.
Yeah.
Okay. So
All
does
right.
anybody else have any other questions for us? Because Dr. Compton has left.
He has left the room.
He has left the meeting.
If you're not
I had a question because I didn't get to zoom in to